Hello, my name is Whitney Hunter-Batteast, founder of Pickles and Popsicles Incorporated, based out of Jackson, Mississippi. And I would like to present the lived experiences of African American women during the maternal care period. The authors include myself, Dr. Tanya FUNCHESS, and Miss Jackie Hawkins. The sites for the focus groups with Pickles and Popsicles, based out of Jackson, University of Southern Mississippi, in Hattiesburg, Mississippi, and Delta Health Solutions in McGee, Mississippi. Background. Evidence has shown that maternal mortality among Black women in Mississippi is significantly higher than their white counterparts. By listening to the experiences of mothers may help tailor interventions and improve maternal health outcomes. The maternal mortality rate is 22.6 deaths per 100 live births compared to the national average of 17.4 deaths per 100 live births. The objectives and goals of the study was to explore the lived experiences of Black women, between the ages of 18 and 44 during pregnancy, childbirth, and labor, as delivered by their healthcare professionals to help improve maternal health outcomes. The methods that we used were 5 focus groups that were conducted in the Delta region, Southern region, and Central regions of Mississippi. Each group consisted of 6 to 8 women. Audio recordings of the interviews were transcribed verbatim, and the responses were coded and categorized based on the reoccurring themes. Some of the themes, 5 reoccurring themes, were common amongst the responses of the participants. Theme 1, we had an overwhelming sense of positive experiences. They got what they need, they were heard, they were understood, and they were educated. Theme 2, negative experiences. And please feel free to pause and read some of the responses. Theme 2, negative experiences provided by their care provider during their pregnancy and beyond, that they either, based on a myriad of factors and things, that they just did not get what they needed. Theme 3, fear, a driving force for anxiety. When you're not being heard, when you're not listened to, you kind of build up this anxiety because you're scared and you're nervous and you just don't really feel like you have the support that you need. Theme 4, the type of insurance dictates the quality of care. We had several instances where the participants talked about, based on their insurance, the type of care that they received. There were even a couple that had 2 experiences with one provider, one on public insurance and one on private insurance. And that seemed to be a huge factor in how some of them received care. And theme 5, improving maternal health through patient education. A few of the participants noted that they would feel better if they had basic information, especially being a first-time mom. There are just certain things that you don't know, that you're not aware of, and just having an extra level of education around some of those things would really have improved their maternal health experience. Recommendations became based on the themes and the responses of the participants. 1, education and assessments on mental health and depression during and after pregnancy should be provided to Black women. 2, Medicaid eligibility for the postpartum period should be extended from 60 days to 1 year after delivery. 3, ongoing cultural and implicit bias training for healthcare providers should be a part of the organizational culture to ensure long-term bias reduction. And 4, empowering mothers with the knowledge and resources to the warning signs of obstetric complications and postpartum concerns that may arise. Pickles and Popsicles is dedicated to continuing education, research, along with bringing the community together. So we have created an implicit bias training and education and a series of videos to help mothers during pregnancy, birth, and postpartum so they know what to expect. Thank you so much for your time and attention today. I look forward to meeting you at the conference.